Hello, my name is Dr. Sharada P and I'm a gastroenterologist at Yashoda Hospitals, Somajiguda. Today I'm going to talk to you about inflammatory bowel disease, or otherwise called IBD. It is very important to not get confused with the other much more commoner condition called IBS, otherwise called as irritable bowel syndrome. Often patients, and not uncommonly doctors, also get mixed up with this term called IBD versus IBS. IBS is a much more commoner symptom wherein the bowel symptoms are very much related to stress. IBD, however, is an inflammatory condition wherein there is ulcers or inflammation or blockages in the intestine, and is a much more long-term disease that needs various treatments and does not improve unless treated. IBD is of two types: ulcerative colitis and Crohn's disease. Ulcerative colitis causes ulcers in the large intestine, and this can cause bloody diarrhea or just diarrhea and abdominal pain. Crohn's disease, which is the other type of IBD, can involve anywhere from the mouth to the anus, and this can cause a much more variety of symptoms like abdominal pain, diarrhea, watery stools, and sometimes fistulas or discharge around the anus, pus or blood discharge around the anus. Both of them need specialized tests like colonoscopy and blood tests to identify the condition, and there are very specific treatments that are tailored to the severity and the extent of disease, and also we tailor the treatment depending on the patient. Say it's a young female who's wanting to have children, the treatment will be different, whereas an elderly male, the treatment would be different. This disease, inflammatory bowel disease, can affect any age group, children at a very young age to elderly patients. The symptoms can be very variable, but it's often easy to arrive at a diagnosis once a patient presents to a gastroenterologist. So IBD treatment doesn't just involve medication. Particular attention has to be paid to lifestyle modification and dietary modification.